Next, it's my pleasure to introduce Lucy Bolton. Lucy is a registered mental health nurse with nearly 8 years' experience working across adult, children, and adolescent mental health services in both inpatient and community settings. Lucy is currently the team lead for the Clontarf Integrated Autism Service, and alongside her project partner Claire Norman, received SusQI training as part of the innovation project run by the Queen's Institute of Community Nursing. Lucy will share her experience of SusQI and using nature to make connections. So over to you, Lucy. Thank you.
Thank you. Thanks very much for having me. So, the project Using Nature to Make Connections gave us the opportunity to explore how nature-based interventions can support well-being, confidence and social connection for autistic adults. So this work was supported through the QICN LC WAG scholarship, and it was delivered in partnership with social enterprise Down to Earth. Change the slide. So like many autism services across the UK, our biggest pressure is demand. The conversation often focuses on waiting lists and assessment capacity, but what we also recognise was a gap in meaningful post-diagnostic support. Many autistic adults experience isolation, anxiety and reduced confidence and limited opportunities for social connection. So we wanted to think differently about how we support people, particularly outside traditional clinical-based approaches. So that's where this project began. Move over slides. So as you can see here in the pictures, we had an occupational therapy garden at our Ysbyty George Thomas where the project took place. However, it hadn't been maintained, hadn't been used for a long time, and as you can see, needed a lot of updating. So instead of seeing it as an unused space, we saw it as an opportunity. Working with a social enterprise Down to Earth, we developed a structured programme using gardening, green woodwork and outdoor activities to support wellbeing and connection. Next slide. So what we did was the programme ran over 5 sessions. We began with a taster session, and this was really important because unfamiliar environments can be anxiety provoking for the best of us. So this then allowed us to work as a collective, considering what the garden could potentially be developed into. This work, as once people attended the taster session, every participant returned for the full programme, and it gave us 100% attendance. And on discussion with Down to Earth, they were surprised that this is significantly higher than typical engagement rates that they usually experienced. It was important to us that the participant helped shape the garden space and contributed their ideas about the garden. This ensured that there was meaningful co-production, and furthermore, participants received Ogoriad Cymru qualifications in nature. Next slide. So as you can see in the pictures, every session started with a planning session where participants were able to consider what plants or flowers would be used. Participants helped transform the space through sensory planting beds, herbs and edible plants. And as the site was home to a mental health inpatient unit as well, there was risk assessments around suitability for plants. This was also considered. So one of the most meaningful elements was the reflection seat, which participants built together using the green woodwork techniques that you can see there in the middle picture. This became a centerpiece for the garden and somewhere people could sit quietly or gather socially. So what also benefit was the use of fire. So you can see the fire pit there. So we were the first health board in Wales to allow the use of fire on a health board premises. And even though our fire safety team were very anxious at the start, and they came to our first session to ensure that everything was as it should be. But it was interesting to see how this could support bringing people together in what is often cold and wet weather within Wales. Next slide. So we monitored wellbeing using the emoji current mood and experience scale, which links to validated wellbeing measures and is utilised by Down to Earth. So as you can see from the slide, it's a digital pictorial measurement tool, eliminating any challenges with literacy levels. The findings indicated significant improvements in emotional wellbeing, with clear increases in positive emotions and reductions in negative emotions. So most noticeably, there was a 50% and 46% decrease in feelings of failure and anxiety over the duration of the project. Strong increases in how connected participants felt and how good they felt about themselves. So this represented a strong positive outcome for participants' emotional regulation and confidence. Next slide. So some feedback that we received and what participants had told us what was important wasn't just the numbers, it was people had described feeling accepted, enjoying the routine and building confidence. And one participant described the group as the highlight of their week. Another explained that the programme helped them feel more confident to try other activities within the community. Next slide. And individual impact. So one particular participant felt really anxious about attending the group. They would often avoid social situations and spent most of their time alone because they already enjoyed gardening, and this was an activity they felt that they could be comfortable with. Over the sessions, the participant became increasingly confident and even supported other participants during the woodwork activities. For the individual, the most important part of the programme was simply getting to know people and feeling part of something. And as the programme develops, we are looking to hope to develop a peer mentor system. And this participant has also come back to, we're running at the minute running another session, and they've come back to that particular group and helping peers there. Next slide. So one of the things the project also highlight was the unintended consequences. So in order to capture both feedback and suggestions for the garden, Down to Earth created an online survey which could be accessed via a QR code. This was put up around the fence around the garden, throughout the hospital, and online via a staff portal. And 80% of the respondents to the survey have been NHS staff, with a sample of the comments there noted on the slide, as you can see. Next slide. So now you can see a little snippet of our garden at YGT. As you can see, it looks a lot tidier, the flowers are blooming, and it's just a lovely space to have for our clients, for staff, for other staff members working within the hospital, and other patients within the hospital as well. Next slide. So one of the most interesting outcomes was around funding, as the scholarship allowed us to start something we had never tried. Because this project sat between health and wellbeing, community and environmental outcomes, it opened doors to different funding streams. So within Wales, we have what's called RPBs, Regional Partnership Boards. This is similar to the integrated care boards within England. So the purpose of these are for areas where there's crossover in services to support services working in collaboration. So one of our focuses was to look at the area which sat in this place rather than health board only, as we felt that within the current climate, it would provide more opportunities when it came to funding. So this immediately opened up funding as we came to the end of the financial year. This is something we utilised by accessing slippage at the end of the financial year of £5,000 to run an additional course. And then building on that, for planned funding this year, we've also been provided with £15,000 funding. This was further enhanced using a social enterprise and has enabled us to apply for further funding through Arts Council for Wales, which is a nature, art and wellbeing funding stream, where we're in the process of submitting our bid for May this year, which will allow us to expand the project to nature-based art. And we also shared our project with the National Neurodiversity Team in Wales, which they've submitted in their annual report for Welsh Government. So however, it is also important to note that we have also factored in the garden project to our job plans, so the project will continue with or without funding. Next slide. So what we learned is nature-based interventions can provide powerful opportunities for regulation, connection and confidence building. So partnerships with organisations like Down to Earth has also shown how healthcare can work differently with communities and thinking differently, which can unlock new funding opportunities. However, most important, it showed us that there was a real demand for patients to provide a point of difference in our services, and the use of the garden project then provided benefits that couldn't have been achieved just through clinical, traditional clinical-based sessions. Okay, thank you. That's the end of the presentation.
Amazing. Thank you so much, Lucy. It's really great
Thank
to
you.
hear such a practical example of how you've built that social connection because we know that's so important for our health and to see those really strong measures and comments that it's a weekly highlight. And also really great to hear about the continuation of the program as well. So thank you very much.
Thank you.